We have 22 physicians, all of whom under 40, nominated by the Academies of Science or the members of the M8 University group affiliated with the World Health Summit. And they come from 22 countries, a very even mix of women and men, and also from the Global South and the Global North. So it's quite a unique group.
Good morning, welcome.
One of the unique things about the Young Physician Leaders Program is it's really designed for physicians who may have a career path that's not only a research path. So these are largely young people who are interested. They're teaching, they're taking care of patients, they're public health physicians, they're in health services research or health policy, and they also are committed to taking action to improve the health of their society, their communities. So they tend to be a little bit on the activist side, but may not be in a situation where they get as much support for their career path within their more traditional organizations. And so what we're trying to do by bringing them together here is to really realize that people like them are very similar across the world, face a lot of the same challenges, the same opportunities.
Most of the places we meet people with the same background, so it's very hard to know which is right, which is wrong. So here I met people from very different countries, different cultures, and I've really been learning a lot as far as how to really deal with human beings. You have a map.
We start with a social event, and then the first day we feed back the data from the questionnaires they filled out and get them to reflect on that. They do have an opportunity to visit science centers and business organizations here in Berlin that are doing interesting things in the world of digital AI innovation, so they can compare what they're doing with what's going on in the broader business community. And then the second day, we really dig down into the issues of decision-making, priority setting, managing conflict, and then get them involved in presenting their particular leadership dilemma to their peers.
I want to improve my leadership skills in order to be more effective in building and growing the organisation at home, so Irish Doctors for the Environment, and also in the clinical setting as well. I think it's really important to get together with other people and learn more about different leadership skills that I could use, where my weaknesses are, and how I can build and improve.
Leadership can be taught. I'm absolutely convinced. This is what we see with these leaders who are coming here, and for some of them it's the first time that they really engage in discussing and thinking about how do I actually lead, what is my objective, how do I get people moving towards my goals, and we see an incremental change even after these couple of days, and they go back, they are motivated and they are equipped with skills and knowledge to make this change happen.
I think it's really beneficial that we have a network that we can speak to, consult with, maybe get some peer coaching on different situations where it would be beneficial to have a different perspective and opinion on in terms of how to manage the situations.
I have had a wonderful time. The collaboration that I've had with colleagues, which has really enriched my experience and really inspired me to feel as though I'm part of a global community fighting for health justice.
It's been 5 years since I went through the program myself, and it comes with very good memories and valuable lessons that I still put into practice today in my leadership journey. It's a really fantastic program, and I really look forward to the IAP for continuing.
We had an opportunity to speak about the importance of leadership in the public health and global health spaces, and it was an interesting opportunity to also share my views, not only as a physician but also as a politician, expressing how we deal with conflicts, but also how do we push forward an agenda that is focusing on generating better health for all. And the leadership of those in the field, particularly physicians and scientists, is critical to make sure that we are evidence-based and data-driven. And I think that to be effective doing that, we need to have very strong leadership skills. And so today's session, I think, was a very strong contribution in that direction.
And finally, they have to design a session that they'll present in the conference itself and participate in the conference. So they get an experience not only in public speaking for a large audience, but also in networking with professionals from all different sectors from all around the world.
This might be one of the best workshops and one of the best programs in the whole world. You are actually representing your country as one of a few selected, hand-picked candidates who your academy or your nominator has identified as someone with a huge potential for affecting positive change in your country.
What we're hoping to do with what are now over 200 alumni is to develop an alumni association that really helps them stay in touch with each other, let the world know about them and what they can bring to discussions in their countries, in their regions, and then also get them involved in working together to solve problems and to learn from each other and to make change, which is why they're coming in the first place.